Thank you. This meeting is being recorded. The recording will be posted on the Cost Board's webpage shortly after the meeting. TVW may also be streaming this meeting live and archiving it for additional viewing opportunities. We have a packed agenda today, which can be found on the first tab of your meeting packet and is also posted on our webpage. And at this time, I will hand it over to Eileen Cody, Chair of the Stakeholder Advisory Committee, to call the meeting to order. And it's just a thank you to Eileen, who's joining us from Puerto Vallarta. I think we owe her a debt of gratitude for joining us today. So thank you, Eileen.
I know, I'm suffering. I'd like to call the meeting to order, the March 27th meeting of the Joint Data Issues and Stakeholders Advisory Committee. I also would like to thank everyone for joining us. I know many of you are juggling between the legislative session and this meeting, but I can guarantee you, you're probably going to accomplish more here than in talking to legislators. I have some experience in that. Anyhow, just reviewing today's agenda, we're going to introduce some new members and staff. We need to approve past meeting minutes. And then we're going to have public comment and an update about our charters. And then hopefully have plenty of time to have some good discussion around how you feel we are interacting with the board and how your job assignments and hopefully your whole experience and process improvement. So I'll now hand it back to Ross to call the roll.
Thank you, Eileen. I will now turn to roll call. I will start with the Data Issues Advisory Committee members. I'll call your name. Say present, please, if you're here, and we will mark you down. Krista Abel.
I am here.
Thank you, Krista. Jason Brown. Jason Brown. Okay, thank you. Anna Morales. Anna Morales. Dr. Enzapike.
Present.
Thank you. David DiGiuseppe.
Present.
Thank you. Hunter Plummer.
Present.
Thank you. Megan Atkinson. Megan Atkinson. Chandra Hicks.
I'm here.
Thank you. Mark Pregler.
Present.
Thank you. Amanda Avalos.
Present.
Thank you. Leah Hole Marshall.
Here.
Thank you. Russ Shust.
I'm here.
Thank you. Jonathan Bennett.
Present.
Thank you. Lee Chow Lee. Lee Chow Lee. Mandy Starr.
Present.
Thank you. Bruce Brazier.
Yes, here.
Thank you. David Mancuso. David Mancuso. And finally, Julie Sylvester. Julie Sylvester. Okay, thank you. So just noting 3 members absent today, Jason Brown, Anna Morales, and David Mancuso, as well as Julie Sylvester. My apologies, board members. And moving on to the Stakeholder Advisory Committee, starting Emily Bryce. Emily Bryce.
I'm here.
Thank you. Jody Joyce. Jody Joyce. Michelle Ratala.
I'm here.
Thank you. Patrick Connor. Patrick Connor. Louise Kaplan.
I'm here.
Thank you, Louise. Paul Schultz.
Present.
Thank you. Bob Crittenden.
I see Bob in the waiting room. portion.
Okay, I will come back to Bob and Audrey or Jen, if you could just check to see if Bob needs any assistance in getting into the meeting. Thank you.
I'm in. Thank you.
Stacy Kessel. Stacy Kessel. Bob Crittenden.
Here?
Thank you. Jeb Shepherd. Jeb Shepherd. Paul Fishman. Paul Fishman. Eric Lewis.
Present.
Thank you. Dorothy Teeter.
Present.
Thank you. Jamie Fowler.
Present.
Thank you. Vicky Lowe.
Present.
Thank you. Wes Waters.
Present.
Thank you. Justin Gill. Justin Gill. Natalie Martinez Kohler. Natalia, I apologize if I mispronounced that. Natalia Martinez Kohler. Adrian Jones. Adrian Jones. And Sulan Milnarek. Sulan Milnarek. Thank you. And I apologize in advance as well for any mispronunciations. I read through all the names before and felt very confident, and then as soon as I started reading them, I felt less confident. So I apologize in advance, and please let me know if I did any mispronunciations, and I will gladly write down the names phonetically so that does not happen in the future. Just noting that we have 6 members of the Stakeholder Advisory Committee not in attendance today. We'll now turn to our next item on the agenda, approval of the January meeting minutes. If you would please turn to tab 2 in your packets, and I will hand it back to Eileen to cover this information. Thank you, Eileen.
Thank you. So as stated, hopefully you've had a chance to look at the meetings. And I think you're looking at what's up. That's tab 2. I think tab 3 is the minutes, right? Yeah, there we go. And we will, any comments about the minutes? Hopefully you have had a chance to look them over. If there's any changes, we can do this by a consensus process. Any comments on the meeting minutes for the stakeholder meeting of August 21st, 2024, which has been a while ago? Any comments? No changes? Then can I have a motion for approval?
Motion to approve that, Emily Bryce.
Emily Bryce has a motion, made the motion a second.
Second, Bob.
Bob Crittenden, all those in favor?
Aye.
Aye.
Any opposed? Okay, those minutes stand approved. Then we have the minutes from the November 20th, 2024 data issue minutes. Any comments from those? Any changes? All right, is there a motion to approve those minutes?
Leah Marshall to approve.
Okay, second?
I'll second. This is Russ Schust.
Okay. All right, all those in favor, say aye.
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 Any
Aye.
opposed?
Tiene una piscina grande y a mí me encanta nadar.
I think that was not any comment. Okay, all right, those minutes stand approved. And then we have the minutes from the November 20th, 2024 joint data issues and stakeholder minutes, meeting minutes. Any comments on these? All right, can I have a motion for those minutes?
Motion to approve, Wes Waters.
All right, thank you. A second?
Second, Michelle Rotella.
All right, thank you. All those in favor? Say aye. Opposed? Those minutes are approved. All righty. So now I think we'll be going back to section 2 to
Yes.
welcome.
Thank
Okay,
you, Eileen. Sorry, I got a little ahead of my skis directing to the minutes. If we could go back to tab 2 and we'll discuss introducing new members and new staff. Thank you,
All right.
Eileen.
all right. See, I told you I could fake it. So, all right, I'm gonna take this opportunity. We do have 2 new members on this, and we want to welcome them to the committees. Jamie Fowler is a new member for the Stakeholder Committee, and she is the current Director of Operations at SCA Health, Washington and Oregon region, and professionally has 22 years of ambulatory surgery center experience and 12 years of management and leadership experience and a master's in healthcare administration from UW. And thank you, Jamie. We're excited to have you join. Do you have anything else you'd like to add to your resume for us?
No, that's a great summary, and I apologize. For some reason, I can't get my camera to work right now. Otherwise, I would be on camera.
All righty. Thank you.
I'm excited to join. Thank you.
Great. And then to joining the data issues, we have a new member, and I'm probably going to slaughter this name, so you're going to have to correct us. Dr. Namuchi Anakapezi. Am I anywhere close?
You're very close, yeah.
Good. All right. And he was approved both members were approved by the board on the January 30th meeting. Dr. Anakapezi's current role is the Senior Director of Health Systems and Workforce Intelligence with the Executive Office of Healthcare Innovation and Strategy for State Department of Health. Prior experience is has experience in major academic health centers, federally qualified health centers in the pharmaceutical industry, is Doctor of Public Health in Health Services Research, MPH in Public Health Administration and Policy, and of course, a medical degree. So welcome. And what would you like to tell us about yourself? You can take an opportunity to defend yourself.
Oh, well, I'm excited to be part of this work. Yeah. Thank you.
Okay, great. And then we're also excited to have, you already got a sneak preview of Ross. Ross Valor has joined us as Board and Commission Director. Marianne Lindenblad, God, can't believe I mispronounced that one. Marianne Lindenblad is now the HCA Acting Director, and she actually had hoped to not be going much past the end of March, but I think she is going to be there a little while longer. But I'm sure you're all familiar with Marianne. And then we have 2 new senior health policy analysts, Jen Scott and Harrison Fontaine, and we welcome all of them to help us get through the work that we have ahead of us. Any of you want to make any comments about your joining the group?
Thank you, Eileen. Really pleased to be here. Noticing as well, I probably should have picked a more reflective picture, a lot less gray in my hair in that picture. So I'm very excited to be here. And Jen and Harrison are the senior health policy analysts that are supporting the cost board's work. And we have been working hard to kind of catch up on the work that's been done, and are really excited about today's meeting to have an opportunity to speak to you about your experience as we develop a work plan moving forward. So really excited to be here and to work with you all, and excited for the conversation today.
Okay. Well, with that, I think we're going to have Jen take over and go for the public comments. If we have anybody that's ready to do public comment.
Excellent. Thank you, Eileen. I will be just subbing in for Jen through the public comments today. If folks could turn to tab 4, I don't believe we had any written comments in advance, but if they are, they're in the 4th tab. We allow individuals to sign up to provide public comment before the meeting, and we start with those that have signed up. No one has signed up yet today. If you've not signed up and you'd like to provide public comment, please just raise your hand. We can unmute you and then we will be able to listen to your public comment. When we call upon you, please state your name and affiliation before speaking. And please accept the invitation to become a panelist in order to turn on your camera and provide public comments. And then depending on the number of public commenters who would like to speak today, we may have to put a time limit on, given that I haven't seen anyone raise their hand yet. I imagine we'll have a little bit more time, but just depending on the numbers, we may have to limit it down to 2 minutes. And we're also encourage you to always submit any written comments or feedback to us via email, and you can connect with us at the cost board email address, which Harrison or Jen can drop in the chat for folks, just so you have awareness today. Jen, is there anyone that is signed up or raising their hand for public comment?
No, I don't see anyone raising their hand right now.
Okay, I will give it just 1 minute in case anyone's thinking about a comment. It would be now is a great time, but we will just pause for just a minute. I remember in law school, they said one of the most powerful things you can do is be silent. And you can really feel the weight of it. So I think that's enough silence for now. There are no public comments, so we'll close this period, but do encourage folks to please give us your comments or feedback, especially as we're kind of in this stage of hopefully moving towards developing a work plan and really wanting to incorporate your feedback and your input. So please feel free to reach out at any time. Just a quick reminder regarding our next meeting will be on the next meeting of the cost board will be on April 24th from 2 to 4 p.m. For folks that are interested and willing to attend. Closing up public comment, we'll ask folks now to turn to tab 5 in your packet, and I'm going to hand it over to Bianca Frogner, Chair of the Data Issues Advisory Committee, to give an update on advisory committee charters.
Thank you, Ross, and good to see everybody here today, this afternoon. I'm going to go through a few updates on some changes here and then recent meetings at the cost board meeting, and then hopefully we'll have plenty of time for lots of discussion today. So here at the January 30th cost board meeting, the board approved a new attendance policy for the advisory committee charter. The new attendance policy requires regular attendance to ensure that the advisory committees can provide feedback to the cost board. Attendance includes both in-person and virtual attendance as counting towards the attendance requirements. So the basis for removal as an advisory committee member is related to attendance, and the criteria are missing 3 meetings in a calendar year, assuming there are 3 meetings held in the calendar year, or 3 consecutive meetings in a 12-month period. Both committee charters have been updated to include language about this policy, which is what follows after this slide and is what's in the rest of the tab here. So you can review where the attendance policy fits in the charter. So any questions about the attendance policy? I know we're missing some folks today, so we'll certainly make sure that everyone is aware of the policy. Maybe I'll just double check with HCA too. This attendance policy is starting as of counting from this meeting onwards, or?
So the attendance policy was approved by the cost board at the January 30th meeting, I believe, and I'll let anyone correct me. So it would technically be in place moving forward from January 30th with the cost board approving it for the advisory committees.
And is today our first meeting since that January 30th?
Yes.
I'm just forgetting,
Yes.
right? That's okay.
Yeah.
So from this point forward.
I think that's fair. We'll expand it. And just a real quick note, during the January 30th meeting, there was some discussion of the language, and we did add in to note both in-person and virtual is acceptable for attendance, just to clarify that for folks.
And I know I brought up a question too about well, people could certainly have life circumstances where they might miss some meetings, but I think the issue is that we don't meet very often. So I think this is a way to really encourage that we have attendance since they are quite spread out.
Yes, and I added, I believe, may language to allow if there is exceptional circumstances to account for it. We're certainly not interested in kicking anyone off of the committee. And just to Bianca's point, we meet so infrequently, just wanting to make sure that we're able to get your input and feedback. So thank you, Bianca.
All right, I'm not seeing any hands, or I don't know if there are any people in the room with questions.
No, I'm all by myself.
Oh, you're all by yourself. All right. The board sometimes is in person, so I never know. Oh, okay. I see Eric has his hand up.
I don't know if you want, I guess my input would be I really support this attendance change. I think this is important work and people should try their best to attend. And if they can't attend, maybe they should pass the baton. So I think this is a good change. My other comment along with that is I really, view these advisory committees as that they're advisory committees to the board. And one process improvement thing that I would recommend to think about is how can we have issues or potential action items come to the committees for recommendation, and the committees provide feedback, and then that's reported to the board, and then the board makes their decisions. Because sometimes in the past it's felt like the board has made a decision and then we get a presentation or it hasn't been as direct feedback. I mean, I think every meeting we should focus on us providing feedback on X topic to the board.
Thank you, Eric. And actually, hold
my
on to
opinion.
these thoughts. We're going to actually have a whole
I'm sorry.
good number of time here, hopefully. And I think if we keep moving, we should have a good amount of time to chat about that. But thank you for that point.
I'm out of control. Sorry.
No, it's okay. It's okay. I left it open for questions.
Sorry.
No, it gives people fodder for thought for future discussion here. So thanks for getting us started. Emily, I see your hand up.
Hi. I appreciate this discussion, and I also appreciate the attendance policy and agree with Eric's points about wanting to make sure that we're all well informed and participating regularly. I have a question actually on the charter, but not about the attendance policy. Is now an appropriate time to raise that?
Maybe that should be a question we bring up later when we
Later,
have a
okay.
discussion about the actual advice. Because what's just as a preview, if you haven't scrolled ahead, and maybe if you're not aware, so in the second half of this meeting today, under tab 7, we were going to want to hear from your experiences and talk about process improvement. So perhaps as part of that, we could talk about the charter items, because it's probably all related and tied together.
Okay, great. Thanks. I'll hold.
Okay, Amanda, want to chime in?
Yes, thanks, Bianca. I have a question on the attendance policy. I think I know the answer. I think it's no, but are there delegates allowed if someone has to be absent? I don't think so, but I wanted to confirm that.
Bianca, I'm happy to take that one. That has not been something that the cost board has considered yet, but that is something that we could bring to the cost board to perhaps amend this charter to account for delegates. I'm not aware of anything in the RCW that specifically speaks to delegates, and I could take another look at that to confirm, but I think that we could bring that to the cost board at a future meeting to consider if delegates is something that the cost board would approve for advisory committee members for attendance reasons.
Okay. Great questions. Thank you, everybody. Okay, so why don't we go ahead and move along, unless there are other questions, but I think some of these things are good conversation points also to bring up later. So now we're going to go to tab 6, and we'll start off with some operational updates. So as kind of mentioned earlier, we have some transitions within the HCA leadership and staff, which we highlighted. like Marianne Lindenblad has now been interim HCA director, Michelle Needham as the HCA chief policy officer, and Ross Valore as the new director for the board and commissions unit. We also have Jen Scott and Harrison Fontaine as our senior policy analysts, supporting the cost board's advisory committees. So additional changes or operational updates are that Josephina Magana, I'm sorry if I'm saying that, okay, is a policy analyst and has transitioned from HCA to another agency. And Kaylee Dufresne, oh my gosh, I really should have asked about pronunciations ahead of time. I'm sorry. Has returned to her
no
full
problem.
brain. Yes, I have heard her name, and as it's one of those same things. I understand, Ross. You start saying it, and you're like, "Oh, no, I don't have the confidence anymore in saying the name," so I apologize. So Kaylee Dufresne has returned to her full-time role. So welcome back, Haley. So then we have new committee member nominations from the nominating committee, and they were approved, and we talked about that earlier. Eileen highlighted that. So we had Jamie Fowler and Dr. Annika Pezzi. So welcome, and great to have you both join us. So let's go ahead and move forward. So continuing with some updates from that January 30th meeting of the cost board, we had some discussion about the performance against the benchmark data. So we were presented data from and given some information on the analysis to given some information on the analysis. So I'm going to just recap some key findings or key takeaways from that, from what we heard when we were presented about the performance against the benchmarks. So there aren't slides here to like highlight these findings, so you just have to listen to me. But you can always go back to the notes from the board to see all that material, because it's always posted online and it's publicly available. So some key takeaways about the performance against the benchmark from 2022. So the benchmark was established at 3.2% in 2022. And the goal is to reduce this down from 3.2 to 2.8% by 2026. So in 2022, the statewide per member per month grew at 3.6%, which is the slowest growth since 2017. Market-wise, only the Medicare market exceeded the benchmark. So that's a kind of point of reference. 5 out of 12 carriers and only 5 out of the 28 large provider organizations exceeded the benchmark. And then spending for VA or Veterans Affairs members also pushed on the growth. So then some other key takeaways looking before 2022, so 2019 through 2022, so looking over that time period, per member spending growth from 2019 to 2022 is driven by growth in the commercial and the Medicare markets, as well as VA spending. Some top contributors to spending growth from 2019 to 2022 were prescription drugs, non-claims, and hospital outpatient data. So those are just some key points, that really came from the presentation that we were given. And again, if you want to see more detail, all the material are posted online that you can go back and kind of dig in to see that. But just since in case folks didn't have a chance to hear it, and to just kind of prime our conversation here moving forward, that might be useful. So we also had a public hearing, and so we had some reflections on that public hearing. Some of the comments that were made during those public hearings, some key comments were that healthcare cost growth affects Washingtonians across the state. This is a problem felt across the state. And there's a request for the board to revisit data collection and aggregation processes. Some highlights from the questions from the public hearing. So these are some additional kind of thoughts that kind of repeats a little bit some of what I said earlier, is that carrier performance against the benchmark, when it came to a question about how those carriers performed, 5 out of 12 carriers exceeded the benchmark. When questions were brought up about how Washington expenditure growth compared to other states, and generally our commercial markets saw highest growth. So commercial markets in our state had the highest growth among all the different kinds of payers. But Washington growth is similar to other benchmark states. When it came to top contributors of overall spending growth by service categories, as I mentioned earlier, those are the prescription drugs, the non-claims, and the hospital outpatient service categories that saw were some of the biggest contributors. And then by market, if you look at the top contributors within those markets, so within the commercial market, for example, prescription drugs, hospital outpatient, and specialty care were among the top contributors in that commercial market. Within the Medicare market, it was non-claims, prescription drugs, and hospital outpatient. In Medicaid, it was, again, prescription drugs and non-claims. So you hear some consistent top contributing factors in each of the sectors, like prescription drugs was constant across all those groups. But it's worth noting that each of the markets has a little bit of variation in terms of what is contributing to the growth. There were some questions around what are non-claims expenditures, like what is covered in that category. And these are payments that health plans make to provider organizations outside of claims. There was some questions from public comment about why are hospital outpatient expenditures growing faster than inpatient. The feedback that was given is that overall outpatient spending per member per month has surpassed overall inpatient spending per member per month in 2021. Increase in outpatient spending is driven by growth in outpatient spending in the commercial and the Medicare Advantage markets. So the other thing that was brought up in the public comment was the new public dashboard. If you haven't had a chance to take a look at it, I highly recommend checking it out. There's a link in, actually, there's a link, right? In the, do we provide
Are
a
you
link
able to
here?
click on that
No,
link?
you don't. Oh, okay. I'm gonna open it up and just show you a little bit. So let's see if this works. Can I share my screen?
Yes. Can we let Bianca share her screen? Excellent.
All right, thank you. Yeah, okay, so you can play along if you like, but I do encourage you to take a look at this. I'm a data person, so I love data. It's great to see all this information come into one place. And there's certainly opportunity to give feedback. I have to say, dashboards are living and breathing things that will never be completely finished. But I think this is a great starting point. So when you go to the link, you can see that you can learn more about data by different segments. And this is coming from the All Payers Claims database. You can look at things by services, by diagnoses, utilization, prescription drugs, providers, and members. Under each one of these, there's a lot of information, and each of the dashboards look a little different, but there are some commonalities. I'm going to just pick on the health workforce one. I'm a health workforce researcher, so I'm going to pick on that. But you can see some general counts of different kinds of providers, how that's being counted. Or you can see, the number of procedures provided by different providers. You can actually also see the number of actual providers. Those are drop-down menu options. And you can see how that's been changing year by year. You can see the changes in those counts by settings or where they're billing to, the kinds of insurer to which they're billing, and then the location of those providers. You can choose it by specialty. You can focus in on a particular year. So this is just an example of what you might see for the providers. There's a bunch of additional areas to click to learn more and dig in to even more of that data under provider detail. There's a glossary on every tab. And you can always go back home to go learn about something else like utilization. Here you get some maps showing the distribution of where people are utilizing different kinds of services. You can see which kind of services are more commonly billed for, how many people are using these services. You can change the reporting year over the last 5 years or so. You have more options in terms of how you look at utilization. So you can look at it by member, you can look at total amount. So a lot of different kinds of ways to go about it. Just like in the provider tab, there's more detail that you can click on. There's that glossary, and you can go back home. So I just want to encourage people to check it out. I know there's probably a significant amount of work that went into that. And I think, you know, it's a great place, a starting place to start answering some questions that folks may have. Okay, so then, okay, where else do we go? So then we went, so we'll go back to the slides here. So what else happened at that meeting? We also discussed when the attribution method should be reviewed. And so there are plans, hopefully, that we might address this at the next cost board meeting in April. I know that the HCA team is working hard to make sure that information is available to have a robust discussion around that. So that means identifying areas for improvement, proposing options for the cost board to consider regarding updated approaches to the attribution method, etc. So we'll keep you informed there. We'll go to the next tab or next slide. So that was a meeting that happened back in January. We had another meeting just recently here in March. And so some brief updates on what happened in that meeting. We had a presentation from On Point about the all payer claims data analysis of cost drivers. They identified top healthcare expenditure categories and expenditures related to behavioral health. This was a nice kind of overview, but somewhat nothing was so surprising. These are some findings. They had findings that were somewhat similar to themes that we had heard to date. Some of the findings I just told you about the benchmark, confirming some of those trends. We also had a presentation from the Institute for Health Metrics and Evaluation on their analytics support initiative project status, giving us a status update on where things are there. And they gave us a couple of questions that they wanted to know whether or not to proceed on certain analyses to complete out their initiative. We also discussed and followed up on the NASHP, the National Association of State Health Policy Association. Yeah, I think NASHP. I think that's NASHP. I think I got the acronym right. But they have a comprehensive model addressing transaction oversight, corporate practice of medicine, and transparency, and talked about how that crosswalks with the current state legislation as it relates to facility oversight. So we've been having these conversations about the NASHP model over a couple board meetings. So we keep coming back to that to better understand where that fits in our current environment. So I think that's all the updates I have from the prior meetings. So I think we're going to go ahead and move on to a discussion portion. So I think I'm passing it back to Ross.
Thank you so much, Bianca. And a big focus of this next section is talking about process improvements that we can make. And listening to your experience so far and any feedback to kind of improve the process. And I'll make a quick note here. I noticed a process improvement that we can certainly make is it would have been much more helpful if we would have included the images of the data from the prior presentation of the cost growth driver as Bianca went through that. So apologies, Bianca and members. In the future, it'd probably be helpful as we're going through those summaries for you to be able to see the data that had been displayed. So noting that already for a process improvement. So please, always let us know if there's anything we can improve. Coming back to the focus of today's conversation on member experience and process improvements, we're all, the cost board staff is all quite new. I believe we've been here, the longest is about 4 months. And so we thought it was really important now as we are starting to review topics that the cost board had identified at last year's retreat, as well as kind of a work plan to guide the work of the board moving forward and the advisory committees, to take a moment before we kind of launch into the full-scale planning process and take time to listen to feedback from the members of advisory committees and the cost board. And we're open to feedback on anything, but some of the topics that we're really hoping to cover today and get feedback on is the types of questions that you would like to be getting as an advisory committee member, as well as how the information flows from the cost board to advisory committees, and have a few slides on proposed ways that we were considering for improvement to get your feedback on that we'll go over as well. And I think Eric's comment was speaking to that. So very excited to hear more from Eric on that. And thought, Audrey, if you could move to the next slide, please. I thought we could start this off with us being quiet and hopefully hearing from you on your experience as an advisory committee member, either on data issues or stakeholder. I included some prompts here, but please don't feel limited to the prompts that are on the screen. Again, any feedback that you have, we would love to hear. So I will let you read the questions on the screen. And if there's any that you'd like to respond to, or again, if you have other topics or areas that you'd like to give feedback on, we'd love to hear that. And so if you have anything you would like to share, please feel free to raise your hand and we will call on you and take your feedback. And again, just to kind of speak to what we're doing with this feedback and ultimately where it's heading. Again, we are internally reviewing past topics that were identified by the cost board at last year's retreat and trying to think about how we can incorporate that into a plan to guide the meetings as we move forward and be intentional about thinking ahead of hopefully what questions could come down to the respective advisory committees. So that's kind of where we're funneling this information just for awareness. So thank you. Jen, do we have any hands up?
Well, I think Emily, we asked her to hold her comments. Maybe she can kick us off. And I know Eric also had comments that you made earlier. So Emily.
No other hands. Yeah.
I'm happy to do that. And I'm sure I'll have more thoughts as we get into our discussion. But the point that I was going to raise earlier, first of all, thank you for opening this discussion. It's always healthy to do. And I, as a consumer representative, am one of the newer members of the advisory committee because we just joined a couple of meetings ago, really, in the span of time following a legislative update to this committee. That is related to a topic I wanted to raise, which is that when I reviewed the charter for the stakeholder advisory committee, I noticed that the duties of the committee relate primarily to input from and about carrier and large provider entity experience and the state experience. And I think it's important for this group also to provide information and feedback from consumer representatives and purchaser voices, labor, business, etc. I know the legislature made the decision in House Bill 1508 to broaden the committee beyond providers and carriers to add that layer of information. So I'm guessing that the charter language itself perhaps came from the board, and so I'm not necessarily suggesting that we change it, but wanted to note that as I reviewed the charter that the information valued seemed to be focused in those areas, and I think it is important to also have a parallel discussion and through line about how consumers are impacted by healthcare cost growth trends. I'll say one other piece towards that, which is that one topic that I would love to have an opportunity to discuss in the advisory committee, in the stakeholder advisory committee, is the underinsurance and employer insurance survey, both of them, that were again introduced by House Bill 1508. My understanding is that those surveys have been tabled for the time being, given the budget challenges. And I think it would be helpful to have an opportunity as a group to help the board brainstorm about what to do next in that area. It is important for us to be thinking through the consumer lens and monitoring that as an additional layer of data in addition to just the cost growth benchmark itself. And I think it would be helpful to have a conversation about how do we make sure, how can we move forward if that survey work is tabled for the near term. Are there other opportunities to move that that data monitoring piece forward in some way? So those are some preliminary thoughts. Thanks for the opportunity.
Thank you so much, Emily. Yes, and I have recorded those. I think it's a great point for us to reevaluate the charter in light of statutory updates. And just to confirm your understanding that we have paused work on the uninsured or underinsured survey related to the budget issues. And just to follow up quickly, Emily, would that be the type of topic, considering alternatives due to funding issues preventing us from doing that survey, as a topic that the stakeholder advisory committee would consider and think of alternatives?
Yeah, and really would welcome thoughts from the group, but I think that I would be interested in that conversation as, okay, well, we can't do this quite the way that we thought that we would. How should we be helping the staff and the board think that through?
Excellent. Thank you so much, Emily.
Thanks.
I don't think Zoom has the same function as Teams where it gives us the order. So I apologize if I'm calling on you out of order. Eric, would you be willing to go next?
Yes, I just want to make my comments at the correct time. I don't know why the video is not coming on, but can you see my video?
I do.
Okay, well, that's great. I just wanted to continue what I said at the wrong time. But I think it's important. This is I view both of the advisory committees as technical advisors. And I think it's important for issues or things that the board is going to be making decisions on to come to the advisory committees first. And then solicit feedback from the technical various people on the advisory. And then the board has that feedback before they make their decisions. And that's been done sometimes, but not done all the time. I think it's been sometimes issues come to the advisory committee after the board's already made a decision. And it felt like, well, I think that would be really important to me. I do think this committee is important and good use of our time. So thank you for having it. I think it's good, but I also think one thing that didn't have this time, the board packet came out in plenty of time. In the past, sometimes it's come out a day or two before the meeting. So getting the packet out like you did this time is important, because having the committee well prepared for their comments is always helpful.
Thank you so much, Eric. And I will have a slide after these questions where we'll go over a proposal of how the information would flow from the cost board to the committees, and would love to get your feedback on that as a proposed structure to better facilitate getting advisory committee feedback on the topics the board's considering. So would love your feedback on that.
Okay, thank you.
Wes, just some comments. Bob said he strongly supports Emily's point, and then Dorothy and Michelle agree with Eric's comments and perspective.
Excellent. Thank you, Jen. And I'll go to, this is testing my vision here.
I think Jonathan is the next up. I think it's the top left corner that will be the order.
Perfect. Jonathan, if you'd be willing to go next. Thank you so much.
Yeah, hey, absolutely. Well, I want to first start by thanking you for taking the opportunity to gather this feedback. I think it's important. So I applaud you for doing that. 2 points that I want to make that are kind of echoing what's already been said, but I personally don't believe that the advisory committees are being used in an advisory capacity as of today. And I think a lot of that may have to do with just the meeting timings of when they are scheduled. But it feels like a lot of the information that we're getting is more just update or informational. And so I'm hoping in the future that we can leverage these committees that do have the technical expertise in a more advisory role. And then the second piece is something that you just touched on, Ross, is it's unclear to me how the feedback is provided to the board, especially the technical expertise that we're providing in these committees. It seems like we don't have that full view of what that looks like. So I'd love to have more insights of what that is. And you had mentioned sharing a little bit about that. That would be helpful for this group to definitely weigh in on what that process looks like.
Yeah, thank you so much, Jonathan. And it's been something we've, again, really been wrestling with internally and kind of coming to the conclusion, at least internally, that having a plan is going to be necessary to have that thoughtful intersection of allowing questions to flow from the cost board to advisory committees and back, so that we're ensuring that everyone, the advisory committees and board members, have opportunities to kind of share their feedback. So thinking that planning in advance, at least the topics, is one crucial step in that, as well as, hopefully going over in this next slide what the information flow would look like. So please, any additional feedback, we would love to hear on that topic. And next, I apologize. Can you read the name of Orvia?
I think it's Adrienne Jones.
Adrienne, I apologize. My vision is lacking.
No, that's fine, Russ. I also have really poor vision, and I'm always having to tell my team and staff to zoom in so I can see what they're typing and things like that. So I first want to say thank you to Emily, Eric, and Jonathan for mentioning what I was going to say. I just echo everything they have said. I felt that there has been a disconnect between the board and these advisory committees and us not being used in our technical capacities. And it's felt like a disconnect and kind of a very siloed in what is happening. And I would appreciate more transparency, which I feel the dashboard is a great step in that. Like, I really appreciate seeing that dashboard. I think that puts us at accountability and transparency as well, which is something I felt was missing prior. I would like to see more disaggregated data because just like you, Bianca, I am policy and evidence driven, but we can't make great decisions if it's aggregated. We just can't. We need to have more of that micro level data to make good informed decisions. And I want to throw this out to the board, and this might not be the space for it, but I work in public health and I work, at the Department of Health, and I'm wondering if there is a space for this committee to be more proactive and not as not be reactive to what is happening in our public level right now of our programs being cut, our fundings being cut, and what that would then mean to healthcare and the rising costs and the health burdens and inequities that are going to come out of this when we don't have these public infrastructures anymore. So I don't know if this is the space for that. But this is weighing heavy in my line of work right now, and trying to find the best space to be, again, proactive and not responsive. As again, I'm middle of dealing with the measles outbreak right now, and what that means in terms of communicable diseases, and again, the health burdens and health inequities that seem to be looming in our future.
Thank you so much, Adrienne, for the specifics on the dashboards, as well as kind of how to better utilize the committees. And I really like that question about thinking about, I guess, what's happening on a federal level or a national level and state level budget issues in the context of the cost board's work and mission, which is to address growing healthcare costs. The plan right now, hopefully, is to take the feedback that we're receiving today, and again, build that into a work plan to then present to the cost board and to these committees. And as part of that, thinking that those conversations of what topics we would like to address, it could be hopefully folded in to that, whether that be a better understanding impacts from any changes regarding funding or those types of things, I think would be great in that context of identifying what the work plan is for the board and the committees and what we want to be focused on. So I hope that at a subsequent meeting that will be the topic, and hopefully we can figure out exactly what topics folks are interested in discussing.
I really appreciate that, Ross. Thank you.
Yeah, thank you. Krista, please go ahead.
Hello, everyone. I'm not sure if you can see me because I can't see myself.
We can see you, Krista.
Okay. So thank you for the opportunity to share information like this. I'm in the kind of the same thoughts as the previous two folks that spoke up, is that I have questions about whether our feedback is actually being heard. So there have been a few times where I took the time to put a lot of time and energy into the data and kind of dug into it to understand it better, sent information back, and it felt like it went into a deep, dark hole. You know, is anybody looking at this? Is anybody responding to this? And it bothered me that when I shared the information, it's like, send this to this email address and don't include anybody else. And so it's like, okay, it's kind of going to this, something's going to happen with it, but I'm not sure if anything ever did. And then later on, I was just, when the board voted on the topics that the focus areas, I didn't understand how they could come to those conclusions based on the different vendors that, you know, provided information. And so I think just feeling like your feedback is heard is important, and it doesn't particularly feel like that right now. And also, when decisions are made based on what, like based on what evidence are these decisions being made? Because I think a lot of times the decisions are being made not based on, you know, specific Washington evidence. It's rather based on kind of national statistics, you know, that may have be just general information, the historic information and national evidence, but it would be nice to just understand better about what are the decisions based on what evidence is being provided, that these are the final decisions, because I'm just having a hard time connecting them. But thank you so much again for this opportunity.
Yeah, thank you, Krista. Just one follow-up. In terms of ensuring that you feel like your feedback is being heard, would a way to accomplish that be bringing the advisory committee along on the topic that the cost board is reviewing and having routine feedback on that topic, so that before a decision's made at the board, advisory committees have an opportunity to kind of review the question or the topic and provide their feedback?
Yeah, I think I followed along with that, just providing feedback from the other committee members and how are they being used? Have they been presented to the board? If they have been disregarded, why?
Okay.
Just more information back to the committee members.
Okay, thank you. That is very helpful. Thank you, Krista. Bruce, please go ahead.
Hi, sorry, I'm struggling with my camera. It's a new computer. I think I'm just paraphrasing some of the earlier comments, but looking at bullet number 4, I'd like to reverse that and take it back to the cost board. Are these advisory committees meeting their expectations? Are we really adding value to the work that they're trying to accomplish? That's it.
No, that's great, Bruce. Now that you say that, I think that may be the right formulation of that question. So thank you. And I'm not seeing any additional hands at the moment.
Well, a couple more just popped up.
Great.
Michelle Ritalia, I think.
Fantastic.
Ritalia.
Michelle, please go ahead.
Yeah, hi. I'll repeat what everyone else has said. Thanks for the opportunity. I think it's great. I'm encouraged to hear that I'm not the only one who wasn't quite able to make the connection between what the Healthcare Cost Transparency Board is doing and what this advisory board is doing. I am a newer member. I've gone to 3 meetings. A couple of things. I agree with everything that has been said so far. I had some housekeeping suggestions. I like So previous meetings that I attended, I wasn't sure if I got the packet. I wasn't sure if I knew what was going on. I wasn't sure who sent it. I did notice that the last one came from the Healthcare Cost Transparency Board. Please continue to do that, and I'll know where to look for things. When the Healthcare Transparency Board materials are posted for upcoming meetings, if you could send a notice that they're posted, that would be helpful, and then I could go look and see what it is they're going to be talking about. When they're posting, I do try to attend, but I have not been able to attend all of them. So when a meeting minutes or when the actual video is posted, it'd be great to get an email saying meeting's been posted. It'd be good to get it within this packet, just to help give those reminders to us of something's happening at the Healthcare Cost Board, and then I could not wonder if I'm feeling behind because I haven't been trying to keep up as well, or if I'm hearing now that other people also kind of feel like not necessarily connected. Because, I represent the employer perspective, and I was thinking that I could just attend the board meeting and have a comment there, and that would be a more direct way to share my thoughts and feedback on what the Healthcare Cost Transparency Board is doing.
Thank you so much, Michelle. And again, for the specific comments about how we email, and a big topic that we've been talking about internally is how to make it easier for members to know what we're doing and stay, on track with us. And your comments about notifications regarding when cost board materials are made public or videos is something that we've been thinking about, and how best to roll up that information to make that easier and accessible to you folks. So we are considering that and have thought through a couple different options. And so excited to hopefully start testing those out and get your feedback to see what suits folks' needs the best. So thank you. Jonathan, please go ahead.
I've already gone. I'd happy to share, but I'll let Leah go first, and then if we have time, I can jump in.
Okay, excellent. Leah, please go ahead.
Again, thanks for providing this space and for having the committees. I'll my comment in chat too of just speaking from the data advisory, and I think you heard a few others say that, especially that group is a technical group. I do think most powerful feedback that we could be delivering is what is most useful for the board, and having some staff direction to the board about what areas we might be able to provide the best guidance in, given the folks' expertise. I think some of the questions that have come, at least to data advisory, have been either so broad that it would take us, becoming staff, basically, to answer the question. And while I think all of us would love to jump in, that's not really our role. So I think just some more thought around how we could be most helpful will help us. Will help the board in, getting good advice, and help us be good advisory members.
Yeah, thank you so much, Leah. That's one of the other topics that we've been trying to think really hard about is at what level to present the information, understanding that you all have other jobs and a lot of other commitments, and to be able to present the information in a way that allows you to provide feedback without necessarily having to do tons of homework. So that is something that we're working on as well, to hopefully present the information in such a way that you have the information needed to provide feedback. And part of that, I think, is getting out our meeting packets with sufficient time for folks to be able to review, and also alerting folks to significant aspects of upcoming meetings, so folks are prepared. So please, thank you, Leah. Any additional thoughts you have, we'll continue thinking about that, and would appreciate any feedback in terms of if we're more successful in upcoming meetings at presenting that information at a level where you feel like you can provide that feedback without having to necessarily do a homework project. So thank you very much. Wes, please go ahead.
Thank you. Sorry, I'm trying to get my camera to work. Yeah, just a bit of feedback just on the notifications of the meetings and the materials we cover. But historically, as we've been through this since the beginning, the topics have morphed over time and the meetings have been kind of brought together. And in some ways, some of it seems a little disjointed, some of it seems appropriate. But we start off with the topic of the benchmark trend and what we can do to influence that. That was a period of time where it just seems like we provided input, then decisions were made, and then we were presented the information after the fact. So it's not really actionable, or the ability to provide input didn't feel like it was there. Then we quickly morphed into the PCP transformation initiative. And then beyond that, we moved into, I think we've now dealt with consumer debt regarding healthcare. It's just a little bit kind of moving in different ways. And I think there was some confusion early on about what is the scope of the advisory committee and how does that fit in and what are you really looking for from us? And I think that's helpful just to get back to the basics and say, what is the committee best used for? And what is our focus and how do we maintain that focus? Happy to weigh in on other topics and other ideas, but there was also a comment made about actions and decisions being made on national information. I know we went through some benchmark reports where the decisions being made were inconsistent with even the data being looked at, where we were looking at just trends on hospitals and profitability by hospitals, things like that were really inconsistent with some of the decisions being made. So it really would, as indicated earlier in the comments, really would be helpful to understand what decisions are being made or what data is being relied upon to inform the decisions that are being made. And, is that national? Is that other markets? Is that local? It'd be good to see that focused on local Washington information and analyses. But anyway, the two key points are focus on Washington data, and second, let's focus on a very clearly defined expectation for the committees as we go forward, so we really know what we're focused on and how to help inform the board and be of optimal help in the process. That would be my feedback.
Thank you so much, Wes. And I don't mean to put you on the spot here by any means, so no problem if you don't know, but are you able to provide an example of a decision that was made at the cost board that you were wishing you had more understanding of the data sources they were relying on or the evidence they were relying on to make that decision?
Well, even the 2.8% benchmark that we started with early in the process, I know we looked at feedback, we looked at things, I offered up feedback about, are we looking at this from even an actuarial perspective when we're deciding to look at trends over time and what's a reasonable trend? Information such as benefit plan design, member out-of-pocket expenses, all of those things come into play on trend. Also, program changes where there's increases in funding over time that are really pass-throughs to providers when you're looking at Medicaid. Trend, are we normalizing for that noise that are pretty material things over time? And in the base period, I brought this up very early in the process, there were integration activities going on in Medicaid, for example, where the program, what may be construed as trend, was actually the implementation of new program designs over time. And so really looking at and getting an understanding of trend really means understanding the components of what drive that and whether, benefits have changed over time. Are we normalizing things for very big swings? Did we normalize for COVID? Are we normalizing? How is the data normalized? What is happening in that? Just to make it so that's just from a data perspective and actually establishing the benchmarks. And I think the committee provided a lot of information on benchmarks even early in the process, but it sounds like decisions were made and here's the trend and this is what we're going with. And we even raised issues and concerns about that on a go-forward basis and even offered up, would there be a period of time to review those to make sure that they made sense with the assumptions made? No, I don't think we really circled back on that. But there were meetings that I've sat in and observed where we were talking about, I'm not sure how the data was ultimately utilized, but we were talking about reports for vendors that have come in, advisory consultants, if you will, that have come in and made presentations to the committees that were benchmarking hospital, I think, investment in investments in charity care, charitable care, profitability of hospitals. I'm trying to think of all the different aspects of that. And I think even our hospital association leader brought up the fact that, you know, if you look at the slide, based on what was being presented, it didn't appear that there was an issue in Washington. As a matter of fact, the hospitals were having trouble. So if you put that on its head and you said what decision was made with that, it was really struggling with how that was being used and what decisions were being made. I know there were some off-light comments and things, feedback provided, but over time I see those things and it makes me wonder how or what decisions are being made based on what data and how is it normalized and, you know, structural wise. And that's really my feedback. It's just, we've morphed over time and I don't know what how the primary way to help at this point is. You know, we jump into, we want to reduce trend, but primary care payment model was about how do we get to 12% expenditure in PCP cost to increase PCP spend as a percent of total cost to 12% when our charter is to reduce medical trend in the state overall. So how are we funding that? Where does that come from? What decisions are being made? So they're kind of conflicting things, but at the same time, I'm not sure how to advise in that capacity. Is that making sense?
Yes, thank you. And the example is so helpful just to be able to kind of put it. I think we've heard from several members that having a better understanding of what information the board is relying on when making those decisions and knowing kind of that, just knowing that benchmark was one of those issues is just really helpful as we kind of can go back and look and see maybe where any breakdowns happened or how we can improve that process. So thank you, Wes.
Yeah, thank you.
Hunter, good to see you. Please go ahead.
Yeah, good to see you, Russ, as well. Yeah, well, I just wanted to kind of piggyback a little bit off of Wes's comments, because I agree, because, you know, I am coming at it from the data issues kind of perspective. And I think we had, you know, during the initial set of meetings, we had some, you know, direction, we had some structure, you know, like this is where we're looking at in terms of, you know, creating the benchmark, and this is the rate, and how do we go about doing that? How are we going to, you know, develop a reporting structure? And so had that at the beginning, and then we entered into more, it seems like, the exploratory kind of phase, you know, creating these different ad hoc, you know, reports that from different vendors that we're getting summaries for. But I think we need to kind of recognize that this is now a board that's been, you know, developed now for several years. And I feel like we need to, you know, enter into the next kind of maturity kind of, you know, phase of it, and providing a little bit more of a cadence. And then, as Wes was mentioning, also kind of going back to what's the anchor points that we can establish. And I think just even going to some of those benchmark statistics that we heard about earlier, to be honest, I mean, how much do any of us, could we really even recite some of those? And we're part of the data advisory committee, and that seems like a certain kind of tether point we should be returning to, so we can see what's been updated, because healthcare's changed over the years, different rates have changed, and then can use that as a commonality to then prompt, you know, additional kind of drill down. Because right now it does seem like we're in a little bit more too exploratory, too disjointed. We need to kind of get back to a little bit more of the structure.
Thank you.
And then also, just as one additional set of comments, like, it's been very limited use in the past, but whenever we can kind of have maybe, you know, certain like internal kind of work groups, you know, for very like concrete specific things, like that would also be helpful. Like, I go back to a few years ago, there was a set of consultants, you know, trying to look at identifying hospital outliers, you know, using different data points, myself, some kind of WISHA representatives were able to then actually go in, kind of, talk with the consultants, provide specific targeted recommendations on, certain adjustments that needed to be done. Like in that required some, additional conversations. That's really hard to do if you're just kind of receiving all the data, in a certain set of slides and expected, just to come up with a solution in, the 30 minutes that's allotted.
Yes, thank you, Hunter. Wow, yeah, that was a ton of great feedback. And again, one of the next slides, hopefully we'll go over a process to discuss improving the information flow, but also hearing from your comments, Hunter, that structure would be helpful in terms of allowing members to kind of know where we're at and where we're going, and some ability to prepare for the discussions that we're having. So thank you, and we're gonna take a closer look at all those comments. And again, hopefully build this into considerations for a work plan for folks. So thank you, Hunter. Dorothy, please go ahead.
We probably all know, at the risk of just saying the same thing over and over again, but one thing that just struck me listening for the last few minutes is, because I feel also that it's been a bit disjointed. Like we started with one thing and then it ended up being something else, and it felt like we were perhaps changing course based on what other states were doing as opposed to what Washington wanted to do. And I'm wondering if what we sort of lost track of is kind of what's our theory of the case. Are we trying to, keep the cost trend down based on focusing on total cost of care, practice variation, rural versus urban, contracting for quality as opposed, what episodes, what is it that we're thinking are going to be the best ways in which to, over time, get that cost trend to stay stable at an acceptable level. So it's just, I think we kind of started out pretty well with this, and then we kind of lost track over the last several months about, is it primary care? Is it medical debt? Is it bad data? Is it what New York is doing, or Massachusetts, or whatever? And I think kind of getting back on track with what the advisory board is really, the cost board really wants to do, and then sending questions to the advisory boards for input, saying, we're thinking about this, what do you guys think? And then incorporating that back into final decisions. It would make a more logical flow and sort of get a kind of back out a little bit and say, what are we actually trying to do? And are the things that we're choosing to work on the ones that we think are the most predictive of keeping that cost trend reasonable and stable?
Thank you so much, Dorothy. And I don't think these comments are redundant in any way. It's really helpful to kind of hear this from multiple members. And again, I'm taking that having structure and some coherence to the topics and the feedback and questions that you're giving and receiving would be really helpful in terms of orienting you to what the cost board's doing, but also knowing that the feedback that you're giving is being listened to and at least considered. So thank you, Dorothy, for sharing that. Emily, please go ahead.
Thank you. Well, I know I already spoke, so I'll aim to be brief, but first want to say, I really like what you said, Dorothy, just now about what's our theory of the case. And I think everyone that's spoken has emphasized there is an interest in digging into the data, seeing what we have been able to find so far and helping the board develop that theory. So appreciated that, Dorothy, and others' comments. One additional layer that I'll add in is that sometimes I think we all would like to be working with Washington data, and I appreciate that, and I agree. Sometimes we don't have Washington data available, and I think that's a really important role for the advisory committees to surface and make recommendations and have those discussions, because we don't want to be operating in a data vacuum or operating on other states' data. I agree with that. But also sometimes we find ourselves in discussions in Olympia where the cycle can go like, well, we don't have data, so we can't make any decisions, but we also cannot move forward with policies to generate that data. And so I actually am wondering if maybe we could could spend some time in this group if this is of interest to these two groups, if this is of interest to the board, thinking about what data we are missing and how that would potentially help us. So that's a suggestion potentially to consider. The last thing I'll say very briefly is just I want to highlight for the record something that Vicky Lowe said in the chat right before she left, and just make sure it gets kind of picked up, because she wasn't able to say it out loud. She had an idea of partnering with the Foundational Public Health Services Steering Committee. And I don't have more information on that, but just wanted to make sure that someone grabbed it. Thanks.
Thank you so much, Emily. Thank you for surfacing Vicky's comment as well. I may need to follow up with Vicky just to make sure we're understanding that. And again, just really appreciate that feedback regarding data sources. We had a brief conversation at the March 5th cost board meeting related to that NASHB consolidated mergers proposed legislation, where we were looking at, through the context of that proposed legislation, some of the holes in our data related specifically to healthcare facilities. And just using that as an example of the point you're making, Emily, that it's really important to identify where we do have data and where we don't. And thinking that that is certainly the role of the cost board in the committee. So thank you for mentioning that. Louise, please go ahead.
Thank you. I appreciate all the comments that have been made, and I endorse all of them. In the interest of not having this meeting end up with some of the same concerns that we are expressing about past meetings, I'm wondering what the process will be to take these ideas, concerns, suggestions, and integrate that into the work of the cost board and the committees. And I know Bianca is here, and I'm wondering if she has some ideas and thoughts about how to move forward with this.
Yeah, I appreciate that, Louise. And I do notice too that Leah also mentions that, we have board members who are participating here, including myself. It's very helpful to kind of hear the conversation. And, I've only been the chair of the Data Issues Committee for, a few of these meetings too. So partly I've been trying to understand some of the processes, and I appreciate that Ross has been, and his team has been trying to understand everybody's interests and concerns. I will say, as a board member, I do feel that, we are guided also as a board based on data, obviously, that's coming with work from HCA and other contractors to help us make decisions. And I have noticed in the last, several meetings that there's a little bit more intentionality about asking, is this something we should be bringing to the Data Issues Committee or the stakeholders meeting? So I have to say, I have felt that has been posed to us as like, should this be something that goes to this committee, these committees? So then I do see that it does come here to the committees. And I do think there is a feedback loop, but I think we could be more intentional about it and a little bit more clear. I think the point, I think it was Emily who made earlier, I think one of the challenges oftentimes in terms of how we're making decisions, obviously, is also, it is based on national data oftentimes, because the data at the state level is, it's not as full, it's not as complete. So a lot of times we have to infer what's happening based on what's happening nationally. I do think that the Data Issues Group is a good group to go to say, hey, do we have that data? And I think we could certainly do more to leverage that. But I think a point that was made earlier, I think then the problem is, like, we say that there's that data, and then there's a question like, who is it who can actually access that data, massage that data, bring it back? So I think there is still an infrastructure problem a little bit, that we know data are being collected by many entities here in the state, but we still don't really have very good infrastructure to bring it all together to then be brought back to the board to make decisions. So I can see that there's some leakiness perhaps that happens just from that alone. I think in terms of where we are as a board, my sense too is, I think it was, who was it? Someone said earlier, is it Hunter maybe, that I think we are transitioning in the last year where we set that benchmark. That's the work that was done for the first couple of years. I felt like we had pretty good information in terms of how we set that benchmark, personally, but that's just my opinion. But over the last year or so, it seems like we're just now trying to unpack where does the money go? And then from here, I think the question is like, what do we do now that we have benchmarks and some data, and maybe now is the phase where we go back in to say, what can we say more specifically about Washington State? What can we say about data that's outside of claims data, which is the easiest data for us to so far get? So those are just some thoughts. I mean, I think this is a useful conversation just to kind of hear that there's a need for better and clearer feedback loops. I think as a cost board member, the advisory committee members really are, I think the way it's written up is to respond to cost board requests. It's not really driven by the advisory group members to then come to the board with questions. Although I think how someone said it earlier, I think it's more a part of a feedback loop that I think is critical. So those are my thoughts. I don't know if Eileen has thoughts. To put her on the spot.
Well, and I can provide a staff perspective on that as well. As I understood the question, Louise, it was kind of how are we going to incorporate the feedback that's been provided to improve this process? And, I'll be honest, I've found the advisory committee work as I've looked back somewhat incoherent and have struggled to kind of understand, what each specific task or how that all fed into a coherent whole at the cost board. The only way that I know to kind of get on top of that is by planning and by having, a topic or questions that are being investigated and planning out in advance how that information is going to flow from the cost board to the committees back to the board. I completely agree, Bianca. The role of the advisory committee is as set by statute is to provide feedback to the cost board. The cost board is directing the work. The advisory committees are in an advisory capacity in providing feedback. And so again, seeing the solution to this problem, and maybe there's multiple solutions, but the main one that comes to my mind and what we're looking at as staff is developing a plan to hopefully guide the work that we can socialize with advisory committee members and discuss at the cost board level to ensure that it meets kind of the needs and expectations of members. But then hopefully having that plan in place will allow us to better respond to comments, topics, determine how advisory committee members like to receive questions and those types of things. But feeling like we need a structure in place to be able to respond to the feedback we're getting and improve. And just feeling without a work plan, it's hard to make those changes in a way that will carry forward and not just be a one-time change. But we're hoping to incorporate the feedback and build it into our process. So, we continue to improve and continue to incorporate this, and it's not just a one meeting thing. So from a staff perspective, we're approaching this with an eye towards planning and bringing that back for socialization with advisory committee members. Thank you again, Louise, for that comment. Adrienne, please go ahead.
I'm just going to be real brief here, I want to go back just a little bit, and thank you for bringing this up, Emily, about Vicky's comment. And the reason Vicky is saying that comment, her and I work within the same realm, and I need to put more context to this. So our funding that comes down from the federal level on all these services that we're providing with Department of Health and with our local health jurisdictions and with the tribes, it has been terminated. They've been cut, and so those prevention services that we have been providing are no longer going to exist. So that's I wanted to put that out there as the context is why Vicky and I are saying this, and then that goes into what is our goals with the cost board and how does that play, because this will increase cost burden and inequities, and so I just want to throw that out there as contextual information.
Comment. I mean, I appreciate Adrienne and just for that comment, just giving that context. And I think that is something that it's not clear maybe how we can surface issues that our stakeholders, our data issues committee members see and bring those issues to the cost board, right? I think that's what I'm kind of hearing is like, there are important things that are happening out in the world. And not that the cost board members aren't probably aware of it too, but we have a unique set of folks here in these two groups. So it just seems like, other than public comment, as I think maybe it was Dorothy, someone said earlier, they could just go to give public comment and give that feedback too. What are the other mechanisms when they're already tied into a committee to surface those issues when they're kind of tied to answering questions that come from the board? And I do think that kind of question about preventive services, I mean, we have tried to talk about that as we know that, you know, in order to reduce spending, that means probably you have to shift more care in a preventive standpoint, right? So how do we get that kind of perspective back into that? So I just want to say I appreciate it, and I can see the challenge of, that's a good example, I think, of where particularly the feedback loop is not quite there.
Yeah, no, I appreciate that. This is my whole career working in public health. We're always forgotten about of the
Oh,
prevention.
I feel you.
You know, it costs a lot less to give a measles shot than it is to respond to a measles outbreak. And so, you know, I will always be, unfortunately, the squeaky wheel in advocating for public health and prevention as in terms of cost reduction. So thank you, Bianca.
Thank you, Adrian, for that comment, in providing that additional context. Jonathan, please go ahead.
Yeah, I'll keep this short. I'm curious about a couple other committee members have mentioned this, how the two committees have morphed kind of over time, and now we're doing more of a combined setting versus the individual. I think others have said we both have technical expertise that we're bringing to the table, but it's done through two different slightly lenses. I was curious, and you may not have an answer, if the format is going to be, this is how it's going to be going forward as combined meetings, or are we going to have the opportunity to have the separate meetings and allow us to drill in deeper into some of these topics that we can bring expertise to? So, like I said, not expecting an answer, but if I had to put in my 2 cents, I'd like to see the committees separated again. We've got roughly 50 people on this call, not to say that that's not great, but it allows us to have an opportunity to share more in depth of our expertise.
Thank you so much, Jonathan. This was one of the topics. We have about 25 minutes left. This is one of the topics I really wanted to get folks' feedback on. Personally, I'm a proponent of splitting meetings. As I read the statute, there is a advisory committee for data issues, advisory committee for stakeholder issues. And by making these a joint meeting, I think at some point there's not two separate committees anymore. It is essentially one committee. And also, to your point, Jonathan, I think there would be a lot of value in allowing 2 hours for the stakeholder committee to provide their feedback on their own technical issue as well as data issues. So I'm a pretty strong proponent of splitting the meetings, and I'm strongly considering splitting the meetings moving forward. But I did want to get folks' feedback on that structure. Whether you appreciate this current structure of having meetings combined, whether it's the sandwich method, which I think has been done, of 1 hour of stakeholder combined and then 1 hour of data issues, or if you would appreciate having the meetings held separately, again, probably 2 hours per meeting, as kind of two options for that. And I apologize, Bob. I know I teed up a question right before you were going to get feedback, so I promise I will come back. Just if anyone had feedback on that specific topic, and Bob, if you do, please feel free. Just would love to hear some folks' perspectives on that.
Russ, I just wanted to mention there were 3 votes for splitting in the comments.
Oh, good. Okay. Well, maybe that's all the discussion we need. Joking. Go ahead. Emily, please go ahead.
Thanks. I am in favor of what I think you call the sandwich method, where we have 2 separate discussions, but they're kind of organized concurrently, which makes it easier to observe for one group to observe the other group's work and stay in touch with it. The reason why I think that's helpful is that While, say, for example, I might not have all of the insight that would be appropriate for the technical advisory committee, I'm interested in their work, and following that will make me a better advisory committee member and vice versa. So I think there is some value to holding the scheduling together, because it means that that folks in each committee are more likely to follow the other's work. So that's my 2 cents.
Emily, do you think you would get the same benefit if you attended the separate meeting if it was held at a different? Is there anything about having the meetings combined that?
Yes, what achieves that? It goes on my calendar as a practical matter. And I know everybody in these groups are very busy, so there is a practical value just in terms of actually making sure that it happens, if that makes sense.
Okay, so it's kind of a bang for your buck approach to get all of this information. Okay, excellent, thank you.
And I understand that might be a personal preference. Certainly can go look at the other meeting too, but sometimes there is some utility in having dialogue or shared learning across the groups.
Excellent, thank you. And I'm not seeing any other hands on this topic, so I'm going to turn to Bob. Again, apologies for the delay in getting to you.
I had my hand up, so thank you. One of the things that comes up in many meetings over time has been what the purpose of the advisory committee are. And one of the common things is just to get everybody in the I'll say the stakeholder committees so that they can vent and talk about what is important for them, and that's fine. And I think a good function, and that's the way this has functioned more or less up to this point. The commissions that I've been on or have worked with over time that have been really effective have been ones that have kind of a plan for the year about what they're going to do over a period of time. They lay out who's going to make what decisions, what information needs to come in to advise that decision. And at that point, once you have a kind of a timeline and tasks, you can say, well, this is a advisory committee function, or this is a data committee function, or this is just a board function. But it becomes much more clear about what we are going to provide input on. And I think our value is, it's good to let us vent, but it's really, I think, much more helpful in this process if we can actually add some value to the decision. So what I'm saying is if we planned it, we developed tasks, and we're clear what those tasks are, and gave us enough time in our discussions to answer the question that was posed to us, I think we would be much more helpful. So that's just an idea. Thank you.
Thank you, Bob. I completely agree, and that's kind of staff's thinking, is to get a high level plan to present and get feedback on, and not thinking that that's going to be a solution to all of these, but kind of one way to take steps towards, I think, the feedback that we're getting, which is a clear, coherent structure to the meetings and an understanding of what each committee's role is and what type of feedback the cost board is looking to each advisory committee to provide, and thinking that if we can put a plan in front of folks and then continue to receive feedback on that, that'll allow us to get, more clarity on the structure, but then as well using the plan as a vehicle to get feedback on the topics and the type of questions that is being sent. So we're hoping that through these steps, we can continue to refine and improve, but completely agree that we see a plan as probably that first step in getting some coherence and structure and organization to this meeting process. Excellent. Audrey, if you'd be willing to go to the next slide. I've been probably over teasing this as more impactful than it may be, but we were in the context of talking about how to improve the flow of information from the cost board to the advisory committees and back to the cost board. We've been working internally to try and identify what an ideal structure for that would look like, and kind of the visualization on the board is kind of what we were thinking ideally of the flow of information would look like. And just to briefly describe it, that would be a question or topic that is at the cost board. The cost board identifies a specific question or topic for feedback, specifically to data issues, would be, at least in our minds, probably the first committee to give information or to get a topic to then provide feedback on. That feedback would then go to the stakeholder committee to then add their, expertise to the information provided by data issues, as well as add their own, expertise from their perspective. And then that flows back to the cost board. And then it could potentially continue on, but thinking that having the information flow, not just from the cost board to an advisory committee, but cost board to data issues to stakeholder back to cost board, to kind of ensure some continuity of that information, ensuring both advisory committees are able to provide feedback, in that feedback is well teed up once it makes it back to the cost board, because it's gone through 2 advisory committees. I'll acknowledge that probably not every question or topic will be well suited to necessarily go through data issues first, then stakeholders. Some may only be appropriate for data issues or stakeholder, just depending on the topic. But just kind of as the platonic ideal of how committee input would be given, this is the structure we were thinking, and just kind of at a high level was hoping to get feedback from this group on that structure. If we don't have a question that we're inserting in here, but in terms of the structure, if this meets the feedback you've been talking about to better improve both coherence, so what the information coming from the cost board is, also allowing both advisory committees to provide feedback to ensure you're aware and know that the cost board will be receiving your feedback, are a couple of the goals we were hoping to accomplish with this. So we'd love to hear folks' feedback. And again, if we're happy to take written comments as well if you'd like to think on this a little bit longer, but did just want to spend a moment explaining kind of at least what we thought of as a potential solution to improve the flow of information.
I see that Eric mentioned that the process sounds better.
Okay. Yeah, and I've seen the comments. Appreciate that. Okay. Well, this is excellent. And I, again, encourage folks, please reach out. I'd be happy to set up calls and meetings to discuss this with individuals, or please send in written feedback on this. Our goal, again, kind of moving forward from this feedback session, will be to develop a high-level work plan, hopefully present that to the board. I'm using kind of soft language here, as this is an evolving process for us, as we're all quite new, but hopefully rolling out a high-level work plan to the board in June, and then also bringing it back in a subsequent advisory committee meeting to get feedback on a plan as well from the advisory committees, and hopefully demonstrating through that kind of how a question would flow through this type of committee input structure to kind of provide a little bit more clarity around what this would look like. Again, just hopefully another opportunity for you to provide feedback to us so that we can continue refining and improving. And just really want to reiterate that we don't look at any of this as a one-stop solution, but just each iterative steps to hopefully improve this process. And we will continue to take feedback and refine as we go forward. So I'm not seeing any additional hands. Oh, Jonathan, please go ahead.
Hey, no, I would agree with Eric. I think on the surface, this process looks a lot better. but I would love the opportunity to provide some additional feedback. If we were to provide written feedback, where would we send that?
That is a great question. Harrison had put in the chat before, it's our cost board email address. I'm afraid to say it out loud because there's a series of letters. So Audrey, maybe if you could put that email address again in the chat so it's at the bottom so folks have access to that. Thank you. And if you'd also put my email in there, Audrey, please feel free to reach out to me as well. I would love to hear any additional comments on that. Excellent. And not seeing any more hands right now. I don't think there are any more slides. Are there, Audrey? Oh, okay. So this is just our kind of catch-all slide. There's our email address if I would have been more patient. That is on the board for any additional feedback you have. Audrey put my email address in as well. Please feel free. I'm also happy to set up meetings to discuss this further, as this is very much the phase, this planning process improvement phase that we as staff are contemplating. And, you know, again, hoping to bring back this information and get feedback kind of at each step. So we'd just love to hear your feedback now, as this is a really perfect time for us to get that. So again, just want to thank you for your time and willingness to discuss this. Please feel free to share any more information, but again, just really appreciate the feedback today and hope to bring this back to you and continue to get more feedback as we go. So thank you. And not seeing any other hands now, I will hand it back to Bianca to close out today's meeting a few minutes early. So thank you, Bianca. Please go ahead.
That's right. Thank you. I just give me one moment here. I really appreciate this conversation. It was really, I found it to be quite a rich discussion, and I think just hearing this feedback, I look forward to the next stage as we figure out how to use all of your time, because I know all your time is very valuable. And it's a lot of time to spend on doing this when there's a lot going on in the world. Again, appreciate all your participation, and also want to thank the public who also have joined us today. We will be, so there is a recording, of course, of this, and there's a summary, and all that will be posted shortly on the website. And we will have our next meeting on May 22nd from 2 to 4 p.m. So we look forward to seeing you there and having this continued engagement as we find ways to reduce healthcare costs and enhance price transparency for all of Washingtonians. So have a wonderful evening, everybody.
Thank you all. Thank you, Bianca and Eileen, for leading the meeting as well. Thank you.
Thank you. Have a wonderful night.
Thank you.
Bye.